We are now recording, so go for it.
Go for it.
Good to know.
Okay.
All
MJ
right,
says
today's date is
go for
April
it.
30th, 2026, and this is our monthly staff meeting for the Vermont Parole Board. And the first order of business is to review and approve our agenda. Do we have any additions? And I have one, which is to have a brief executive session to discuss a matter that is potentially involving civil litigation, which the board may be part of.
Make a
Any
motion.
other additions?
I'll make a motion. We approve the agenda with the additions.
Okay.
Second.
Thank you. Any deletions before we finish that motion? So the motion is to approve the agenda with the single addition covered minutes ago. Those in favor signify by saying aye.
Aye.
Aye. Anyone opposed? Okay, we are 5 in favor and 2 absent. Next order of business would be to review and approve the minutes from our last meeting in February, on February 23rd. Has everyone had a chance to review those minutes?
Yeah.
Are there any suggested changes to those minutes?
Make a motion. We accept the minutes as written.
Thank you.
Second.
Motion has been made and seconded to approve the minutes as written from the February staff meeting. All those in favor signify by saying aye.
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 We are 6 in favor and 1 absent. Thank you. Morning, Katie.
Hi, sorry about that. My computer wasn't cooperating.
Okay. And so our first up item is the review of the Medicaid reentry program, and our friends from DOC are here to cover that for us. So welcome. Good morning, everyone.
Good morning. I believe my colleague Cassidy Renfew will be joining us as well.
Okay.
But I will get us started. And before I share my screen, I'll just introduce myself. I'm Jade Christy Maples. I joined DOC as the project director over the Vermont Medicaid Reentry Program in January. I do have 15 years of healthcare and healthcare policy experience leading into this role, so really serving as a bridge between DOC and our partner agencies to make sure this program is running as best it can. So great to meet you all. I have a few slides I'm going to run through today, and then if there are any questions, happy to field those as we go or at the end, whatever the group's preference.
Great.
All right. So I'm going to just do a really quick recap. I didn't know this had animation, so I don't know what's happening right now. But I'm going to do a really quick summary slide, and then we'll get into the nuts and bolts of things. So if you have questions coming up on this first slide, just know that I'm going to be sharing more detail of the mechanics as we get into things. So starting in January of this year, DOC and the Vermont Chronic Care Initiative have been collaborating to implement VMRP, which is this Medicaid reentry program, which is part of the global commitment to health. I'll get into the mechanics of what that means on the next slide in terms of how we in Vermont administer Medicaid and how we work with the federal agencies to support that. VMRP is encompassing parallel efforts to enroll the incarcerated population and reduce delays to their access to care upon community reentry, as well as offering some additional care coordination services for folks that are wrapping up their sentences and have been incarcerated. So really trying to serve as a bridge back into the community, in addition to that Medicaid coverage and, greater access to services because of it. Since the beginning of the year, DOC has supported over 500 of the incarcerated population, both detainees and sentenced people, with Medicaid enrollment. That includes helping folks who had coverage previously and it expired, or folks who haven't had Medicaid before, with applying for their coverage. I'll get into how that works and some rules around it. But essentially, this is like creating a circuit that can be turned on upon community reentry to reduce barriers to care. In terms of individuals who are completing their sentences and planning for community reentry, they have an option to voluntarily participate in that care coordination component I mentioned. And that's being supported by the Vermont Chronic Care Initiative and a new set of reentry care coordinators they have established within their team as of this year. And those care coordinators are being supported and coordinated with through DOC and our medical contractor, WellPath. The services in general, like I've mentioned, aim to reduce barriers to care, enhance how folks are interacting with services as they bridge back into the community, and support, any barriers that are being experienced in terms of how to get to that appointment, how to get a referral to those services that you need. I do want to emphasize that care coordination component, VMRP, is what we usually refer to it as, is not a mandatory program, and it's not really a comprehensive set of services that's really aiming to serve an individual's rehabilitation. It's really intended to enhance and build upon the services that DOC, parole officers, and case managers before release are involved with setting up, so that there's really even less seams to address, I guess, as folks re-enter the community. All right, so that's sort of the global view, 12,000-foot view. I'm going to get into the program history and then how we're implementing it to give you a better understanding of what's happening. So Medicaid statute at the federal level generally prohibits an individual who's incarcerated from accessing Medicaid benefits. So in general, states historically have had the option to suspend or terminate Medicaid benefits during someone's incarceration, and that includes whether you're detained or sentenced for more than 28 days. The big thing here to keep in mind is historically Vermont has terminated Medicaid coverage until the beginning of this year. A few years ago, CMS, so the Centers for Medicare and Medicaid Services, issued guidance allowing states to seek to test strategies around community reentry for incarcerated people. So what that means is really giving states the chance to apply to bend the rules around that federal statute and the limitation of how Medicaid benefits can be accessed during that incarcerated period. And Vermont is one of the first states to receive approval from CMS to take advantage of that opportunity to test new strategies. And when you see the term global commitment to health, that is a larger program that the state has implemented under a mechanism called an 1115 waiver to do a lot of innovative work with Medicaid and flex how we receive federal funding and use state dollars to match to those dollars to deliver services to Medicaid eligible populations. So this is really a part of that program, and just one of many pieces that the state's taken advantage of. So coming into January 2026, the state is implementing sort of three parallel things that help us bring together this reentry program. First, we are switching from a termination of Medicaid at incarceration to a suspension of Medicaid. How I like to explain that is instead of kicking folks out of the system, we're leaving the circuit there. We're just turning off the light switch. So the benefits are easier to turn on when someone reenters the community. Really, this is a huge boon. It could take a week or two to find a community assister for someone when they reenter the community. Now, all DOC has to do is tell DIVA, we have released this person, and within 24 hours, their benefits have been turned back on. The second piece is enrolling people during incarceration. So, as I mentioned, DOC has helped over 500 people apply for Medicaid as Medicaid assisters, essentially. And when we're doing that, we're applying for Medicaid and then they are getting suspended sort of in real time. So the circuitry is now there, it's still turned off. And then the thing that we'll focus on the most today, the last piece here, is really that Vermont Medicaid Reentry Program and the enhanced case management that is offering post-adjudicated individuals who are planning for their release from incarceration. And so pulling all these pieces together, we're really looking at trying to promote continuity of care and forwarding of health outcomes for justice involved groups. We're connecting people to Medicaid before they leave so that it's there and ready to use as soon as they're in the community. And we're helping start to really enhance and put an additional layer over folks while they're planning for their reentry, connecting to providers, connecting to social services, with the hope that that advances some reduced recidivism over time. Okay, and this slide sort of doubles down on everything I've been talking through. Really, our objective through this program is to test whether enhanced reentry services like this can be used to improve outcomes, so public safety, continuity of care, but also reduce costs over time. So looking at how this population is utilizing services when they reenter the community, looking at recidivism and reincarceration as a key indicator of whether there's some improvement there. This is all going to be evaluated through the 1115 waiver process. So any state who has taken on an 1115 is required to evaluate their program, look at outcomes, make tweaks along the way, and then eventually we have the chance to renew, and if not modify, to improve the program in a few years once we've really had a little bit more wind under our wings. All right, so speaking specifically to the VMRP care coordination piece, so that's what's being administered through the Vermont Chronic Care Initiative. Folks are eligible for that if they are post-adjudicated and have been incarcerated. We are supporting community referrals for folks if their referral was not completed during their time in a facility. So really short stays, we are supporting community referrals in that interim window. They are eligible to begin pre-release services with VCCI 90 days prior to their release date and up to 6 months post-release. So what that means is VCCI is starting to engage with them while they're still in the facility, and then they continue that engagement for up to 6 months post-release. And people do need to be enrolled in Medicaid to receive these services. And then, as we start to look towards that 90-day window, we're offering, would you like to receive this service? We see that you're enrolled in Medicaid. We see that you're coming up on your 90 days, and folks can choose to opt in and begin participation with VCCI. Okay, so what does that look like in a little bit more detail? So when someone decides to opt into the program, we send a referral to VCCI. At that time, their care coordinators start to work with DOC staff. They receive care history from our medical contractor, and they start to set up appointments to meet with an individual, conduct an assessment of their needs, and start to develop that relationship. They are coordinating with our caseworkers as well as the medical discharge planners to understand what providers are we being connected to, what additional referrals need to be made. And then once someone is released, they start meeting with them in the community. That might look like direct coordination with the parole officer and timing things with intake. It might also look like ongoing meetings that make sense for the individual and the care coordinator based on their relationship. I would say the big caveat or sort of modification to how we think about VCCI's continued enrollment is if someone is eligible for more comprehensive long-term care management services. So that looks like someone who has a traumatic brain injury or choices for care, more comprehensive disabilities. If someone falls into that category, what we're looking at is probably a warm handoff from VCCI to the more appropriate agencies that could serve them in the community at that point of release. All right. And then this last slide is really sort of the long-term point of view, who's involved where. There's a lot of moving parts. But really this is starting at the point of incarceration, start covering them with Medicaid if they choose to receive our support with that, and then moving into the release planning and how we start to, again, make sure they have that coverage that helps them get eligible for VMRP, offering the program if they are wrapping up a sentence, and then coordinating across DOC, WellPath, VCCI, and then community providers to develop that care team to wrap around someone as they're planning for their community reentry. Okay, I talked a lot and very quickly. I'd love to stop sharing my screen and field any questions the group has. Was this helpful, and what's coming up for you?
I have a couple of questions that kind of immediately came to mind. So are these positions, these enhanced care coordinators, are they throughout the state in each
Yes.
in each district?
So
Are they in place now?
There are 6 care coordinators distributed throughout the state, and they each have an assigned region.
Okay. And are they currently in place now since it just went into
Yes.
effect in January?
Yes.
Okay. Is this program only for, can they be referred, I guess is what I'm asking. Do they have to already be incarcerated and still have 90 days left, or can DOC workers refer them if they've just been released?
Jade,
Yeah,
I'm going to take this one because I kind of know where this is going with granting parole. This is
No,
where
it's actually got nothing to do with parole, but
well,
it's something to do with my own private practice, in my own practice.
yeah. So
as a therapist.
Yeah, one of the things that we're really working on doing is hitting that at 90-day marker. So when
Okay.
somebody has that straight to serve term or probation term,
Okay.
we try to get that referral as fast as we can at that. Like we can start at 90 days with give or take earn time. You know what I mean? We try to calculate it into our best ability. But that 90-day mark is like what I like to say when Jade and I have done this now since January in Oz, you know, in the green emerald city where everything's pretty. We know that exact release date. Unfortunately, because we all work in Department of Corrections, it can happen 3 days and the court releases. So we've built in a kind of a buffer that if someone is released and that referral did not get in, the field can do a VMRP referral 15
Okay.
days from their release date.
Has to be,
How,
that 18 days is a firm, has to be within 18 days.
yeah, that
15.
15, it's 15 day
15, sorry.
marker. Yep. I think like give or take a day because it falls on a holiday or something like that. I think we have
Okay.
some flexibility, but we don't want to
Okay.
present like we've got all this flexibility to throw in. We don't.
Okay.
This is really about that concentrated building it and the continuity of care, starting it in the facility and getting it to and out to the community because it's not supposed to be long term. It's
Right.
up to 6 months, but if they're showing that stability and services are in place and they're kind of just rolling into life at that point, VMRP services kind of will back out, and that rolls into the probation officers hopefully just supervising at that point.
Okay.
Um,
So that
how
is
the-
good to know.
yeah,
sure.
how this impacts parole. So if DOC is moving to release at their minimum, they've done everything, they've been a model individual who's been incarcerated, they've completed programming, they've done all these things. We're moving towards that minimum release date, which is when the parole board will also see them, right? So you guys will start hearing that, hey, I'm working with this care coordinator. I'm going to use one of the Tia, who's set up in our Chittenden area. I'm sure you're seeing a lot of women coming through. Is like, so they'll be like, oh, I'm working with Tia. Now they're choosing to work with Tia. We're not going to be sanctioning and or are we imposing, so that the committee can't or DOC can't say you have to do this. That this is a very volunteer program. We're not I'm going to use the language as you guys, because you all know me, it's like we're not, stretching our muscles and saying you have to because we know this is the best for you. They have to choose to do it. And so that's the same if they choose not to. We can't sanction them for not doing it. So the parole board in assigning conditions, when you guys are looking at this, because I know, they're stoked. They're going to have a release plan now, right? That they're like, we can't add to the conditions nor encourage conditions saying you have to work with these people with VMRP service.
So that can't come up as that can't be also used as a violation if they haven't met, if they agreed to it, but then didn't follow through with it. That can't be listed as a violation too, right?
Right, correct.
Okay.
That is the same messaging going out to the field staff. We may say that we've exhausted services, meaning, we threw everything and nothing stuck and they've committed a new offense. That, when you look at case progression, that's a factor, especially with somebody with a long criminal history. But it's not something we'd say, you're receiving a thinking report because you missed an appointment with your VMRP coordinator. We're not going to do that. That's something you guys know. I know you guys know what that is because I'm sure you've seen it in the incidents of violations of like, you didn't show up to meet with your VR, your higher ability person. Now you have to increase reporting instructions. That shouldn't be the messaging we're pushing out, is that that's not the case.
Okay.
Yeah.
One of the other questions I had is, did they have to, let's say someone is coming up, they're pre 90 days, but their 90 days, they're going to be out because they've maxed out. Do they have to still be involved with DOC at release to get enhanced services?
No, ma'am. So that's kind of, we are still offering that services up until,
even if they've maxed out.
Even if they've maxed out, we can't refer them from the field. The probation officer can't refer them on max out, but if they're maxing from the facility, absolutely, hopefully during that time frame, we're looking and those referrals are being made, then it becomes the individual's choice if they want to continue it. I hope so. They're going to be set up for more success.
Okay. That was my hope, is that they don't still have to be out on furlough, probation, parole, or anything to keep it. They can have it even if they're getting released because of max date.
Yep.
Yeah,
universal
it's
service.
Purely based on the categories of being sentenced and coming out of incarceration, and they have that Medicaid status. And they can participate regardless of our discretion.
And just out of curiosity, have you seen the referrals, the types of referrals that have been coming in? What are you
I see.
noticing any trends? Are you noticing any certain types of incarcerated individuals that you're seeing more referrals for? Like, what are the enhanced services mainly doing at this point? Is it more
So
social services, case management, or is it more medical?
it's actually a combination of both. We have a couple success stories. I try to grab them when I can because you guys, implementing a new program, you're like you keep falling. But we do have some success stories. We've had with the care coordination, they've been able to set up medical appointments and an extension of care from the facility. That's where the big piece is with WellPath, because they're at the table too with this overall program for the field. So there is going that continuity of care, we're firming up those referrals to PCPs, the caseworkers that may for more extensive care. They're also meeting with them, so it's a little social. It can be, we're trying to find that balance between what work is being done before. I don't know if you guys, I'm sure you guys know, Angel Coro up in St. Johnsbury is a phenomenal reentry PO. So we're wrapping that in and we're kind of all building. Now, these are new employees where they have to learn us and we have to learn them. But so far we do have success stories of connecting services. Chittenden is one of our strongest referrals, getting those cases to VMRP, and we're seeing success in that in continuity of care, both meeting and social ed health. Long way of saying yes, we are seeing some success.
Have you seen referrals for just social services needs, like housing, food, employment, like those types of connections?
Well,
Needing those services?
That's part of the kind of where we've been moving with reentry anyways. We're still making those referrals to higher ability, and the care coordinators are pulling them in. That's specific to employment. We're still making those referrals for substance use disorders and mental health. They're pulling that in. We may say, this is part of your case plan, and the care coordinator would be like, okay, these are the services where there are, and start making those connections.
Oh, good.
It's kind of offering another hand. Again, like we're gonna just all hold, see if it's a total wrap services.
Yeah.
Do you see this picking up more? Do you see a lot of the caseworkers referring?
Well,
more?
The exciting thing is that we are pushing it, and yes, we are asking and looking at cases to get those referrals. Again, it's we did a push of the information out on tablets to the IIs who are incarcerated. We've done multiple presentations, both to executive leadership and down. I've worked, and Jade has worked with and Monique, obviously, Sullivan from the facility has worked extensively with the CSSs and the PPOs. So if a case comes to us and we see that they're getting out, we look at the Medicaid, we look at the information added, we look at safety and security also for the care coordinators, and we push those referrals. VCCI responds. They have like 3 days to assign a caseworker and to make contact.
Great.
Afterwards. So we're really working it. Of course, we have the kinks of we're missing, where are they being released from? So a little back and forth, and the little hiccups with, did you sign the form? Because we still have that paperwork of releases and things like that, the administrative stuff. But so far, I think, Jade, you have some numbers, right? We've pushed out for VMRP referrals.
Yeah, I think we're over 75 live folks since the beginning of the year. It could be higher than that in the last week. I know you were out, Cassidy, and then caught up a lot.
So do people have to be Medicaid eligible to participate, or does that affect everyone?
Yes, so it is Medicaid specific. Dean, the basically the structure of the waiver is, and this is a little technical, but DOC is able to bill for certain services in that 90-day window. And we're using the billing of that to Medicaid to pay for VCCI, essentially. So we're covering each other, and it ends up being neutral to all the way the funds flow.
And if they're a Vermont resident and they've reported no income, which we know this isn't a marginalized population, they absolutely are eligible for Medicaid. And so I think even in my career, I think I've maybe had 5 people on private insurance ever.
Yeah. And
So-
the cool thing is actually it's not limited to Vermont residents. So essentially what we're doing is we're enrolling non-residents as well. And if they're being released to Vermont, they can participate in the program as well. So like it ends up being seamless. If they're leaving Vermont, obviously they can't participate. But
That's
if
like the
they're
only
staying.
exception if they're ICOTing out to another state
Yeah.
Do
and
other
or
states have
Fed
this?
hold.
Do other states have the same type of program?
We're one of the first, actually. I think there's
Yeah.
only 2 or 3 states that are alive with this program right now. There's more that are planning to implement it in the next few years. And I think what you would see, the way these things work, is it ends up like trickling outward from there. Our first evaluation will be done in 2029. And at that point, we would also be looking at continuing in some capacity if the outcomes look the way we hope they do.
Great.
I want to
Any
get
other-
to some of the
ahead.
nitty gritty though. So when people are paroled, and this is, I'm not no judge, I just want to do the timeline. When we have somebody who is paroled, who may not, who, you know, where the parole board chooses to move forward and they were not recommended by DOC, there will be we're going to do the best that we can. The parole board gratefully gave us that 10 days for those higher risk RSN cases. That referral can be done within that time frame to hopefully set up services. So if those cases come to you at their minimum, they're not being recommended, that you may not see them having VMRP referrals in. And that will have to come afterwards. If they're like, oh, they're eligible to an immediate release for the residents, and we do a residence investigation, that's when they will get that referral. So if they're not in that release window, you may not hear about it and be like, oh, why aren't they being VMRP? Well, because DOC is not recommending them for release. And so if the parole board makes that decision, then we just have to accelerate the process in making those referrals and ensuring that those things are in place prior to the community. So that's just, I just really want to be clear about that. So as you guys see these coming in and be like, well, why aren't they? Especially around those RSN cases, you know, which we're all, you know, both parties here are juggling and on the best supporting those individuals in the community and or being paroled out.
So it doesn't
that
mean
makes
they're
sense.
not going to participate in the program. It just means they can't start as quickly.
Correct, sir.
Yeah.
And then again, it's on them if they want to choose to use it. Found very few who don't. Usually there's more complex care needs. Maybe it's understanding, maybe it's afraid of the systems or distrust. You know what I mean? So we are supporting those conversations in the facilities for those who do decline it. We bring it to them again and be like, hey, just maybe there's more complex care needs than we got.
Thank you.
Yeah.
Other questions or comments? Go ahead, Cassidy. Sorry.
Yeah, one more thing. So there is a training. I sent it to Mary Jane. It's VCCI. It's called their care. Oh, geez, Mary Jane, care coordinated trainings. There's 4 of them. It's an AHS training that kind of gives a 101. It's about 20-minute slides. You have to complete them all the way. I sent all 4 links for external parties. It is an AHS directive, just as an option, not saying like, oh, we have asked our probation officers and CSSs all to attend all 4. So if you're looking for more information or want, that is available both also to external parties. It's not, you know, it's in our caps. I don't know how you guys interact with that, but
I haven't had a chance to look at it yet, Cassie, but thank you for sending it over. I was going to look at it more and then pass it along to the board.
It's just more information.
Yeah, of course.
That's all I have, Dean. I swear, unless you guys have other questions, because you both have Dave here and myself, if we want to take 10 minutes to talk about anything that else has come up for the parole board for DOC, I'm here for that too.
Great. Thank you. We did get a copy of the brochure as well in our packet, so thank you for that. Other questions from anyone? Well, thank you both. Appreciate it.
Absolutely.
Thank you for having us.
And there's
Yeah.
no general,
Thank you.
so just before they leave, there's no general questions that you all have for Cassie and Dave. I'm just putting it out there. It doesn't have to be about the Medicaid, but if there's anything else, we can have a little brief forum if you guys have anything.
Or anything I can follow up for and provide the next round.
I just wanted to give you
Sure,
that
yeah.
opportunity.
I don't have anything. Anyone else?
I don't have anything.
All right.
Well,
we have
perfect.
Thank you.
Thank you for having us.
Thank
And then I hopefully will see you guys next month. Or Dave.
Yes.
Bye, everyone.
you.
Happy spring.
Bye.
In person.
Yeah. There. We're done. Bye now.
Okay. So next item up on our agenda is our firearm definition issue that we wanted to present and have a brief discussion about and hopefully make a decision on where we want to go with this. The background on it is, and I'm sorry, I don't remember who was on this hearing with me, where we had a violation hearing for an individual who was charged with violating our condition on firearm possession. And he denied that in part because he did not think the firearm was legitimately considered a firearm. And at the same time, we went to our definition, which really wasn't as specific as it really needs to be to discuss this issue. The nuts and bolts around it were that he had some mental health issues that he was dealing with, but in addition to that, it threatened to shoot someone with whatever it was that the firearm he had in his possession was. We had a police affidavit that indicated that it was a black powder firearm that was in his possession. When we got to the actual hearing, the photographs that were provided by his family were 3 firearms that looked like regular rifles with scopes on them, but were in fact compressed gas pellet guns. So we didn't have any other evidence that the one that the officer referred to in his affidavit was in fact another firearm, but certainly the compressed air pellet gun, if that in fact was what was being used to threaten someone, the Department of Corrections felt strongly that that should be considered a firearm, and we agreed and made a finding that he was guilty of violating that condition. And so the concern raised by the Prisoner's Rights Office attorney was that it doesn't appear that that's in our definition of what a firearm is and how it's explained and so forth. So when MJ and I talked about it after the hearing, we felt this would be a good time to take a look at our special condition and address that issue. Ultimately, the person was continued on parole, and we made it clear that this was a concern about someone being threatened potentially by this type of firearm. So I think MJ has included a copy of the draft that I put together. I don't know if everyone's had a chance to look at that.
And can I just add a little bit to this, Dean?
Yeah,
so also,
sure.
For all of you, I did include 3 cases where this topic has come up, where we have ruled. So the reason why I wanted to bring this up is we need a clear definition of a firearm because we don't have one. And 2, we need to determine whether an air pellet gun is one, because we've had, I think, almost all the board members have experienced one of these cases, and we've had different rulings. We need to have a consistent ruling on this. So that is the reason why. That was also why I wanted to bring this up, is because we just need to nail this down.
So the draft language that I put together kind of addresses the whole issue specifically, which could be used sort of as a definition for Condition 5. It states simply that the parole board considers possession of any muzzleloader, black powder, in parentheses, antique firearm, or replica to be a violation of Condition 5, and additionally possession of any compressed air firearm that operates using non-ignited compressed air or gas be considered as a firearm under condition 5. Thoughts, questions? Wayne?
I think it's good to have it defined.
Angela, I'm sorry.
I think it's good to have it defined clearly because I was on 2 cases where we
Right. Yeah.
it wasn't so clear the first time and then it was. So this gets us all on the same page.
Wayne, comment?
A couple. I guess I'm okay with your idea, except I think you might want to consider additionally possession of any compressed air gun, not firearm
Mhm.
or weapon,
Okay.
because you
Yeah.
redefined firearm in there. And
Yeah.
Then my
So
other thought is that pellet gun, BB gun not already covered by or replica? And if you strengthen the
Well, you
replica
could-
of any
you could make that argument.
firearm,
You can make that argument. Doesn't this make it even clearer though? Then so there's no question.
So if
well,
I have a
I'm
question
sure-
too.
Yeah.
I'm sure you've seen all the airsoft. I mean, that's a big deal. Airsoft guys have all these make-believe wars with them. But I mean, all those airsoft guns are so truly replicas that any police officer confronted with one is going to use deadly force.
I know. Yeah.
So is possession of an airsoft gun by a parolee a violation? I guess they do use compressed air.
Right, but they don't fire a pellet, do they?
No, I guess they fire a little softball or something.
It's not so soft. I mean, I've actually seen them. I haven't been
Yeah.
hit by one, but I've seen, and they're actually, from what I was told, they're actually legal in New York.
Yeah.
To have on you. I don't know. That's what I'm hearing anyway, but I think
So-
spelling it out like you did is really important because I would hate to see somebody come back with an argument of, using that just like with the replica, but if it's legal in some states to have, they could come back and try to argue, well, they're legal to have, so I wasn't technically, I would hate to have that argument. So spelling it out like you did by clarifying it, I think is probably definitely a better idea.
I just struggle with our condition, and I think we've had this conversation before, that we leave it to firearms and/or ammunition. And to me, I know we don't want to change the conditions at the moment, but to the kind of with Wayne of we're changing the definition of a firearm, and a pellet gun generally isn't in the federal or state definition of a firearm. So the question, it almost feels like our condition should be expanded, not our definition necessarily. Because to me, if I was a parolee and I read the condition firearm, I'm not going to go probably dig for the definition of what a firearm is and be more apt to if our condition was more specific. But
That's a good point. Yeah.
Anne, can I ask a question from Prisoners' Rights?
Of course, Emily. Good morning.
Thank you. So I'm speaking as someone who has chickens. So I want to put it in context. I'm I live in a village of 700 people. I'm concerned about people who may be already out on parole who live with like if I have someone in my household, my son or something, who's already on parole, and I do have a pellet gun because sometimes possums get into my chicken coop. I mean, there are lots of valid reasons. And, are we going to be applying this retroactively to people who are already out and maybe living in residences with a pellet gun? And again, in rural areas, like, I'm not someone who generally has firearms, but in rural areas, sometimes I have to put down an animal for kindness, including some of my chickens. And so I'm just wondering kind of how we're going to handle people who are already out. I understand going forward that a PO can sit down and discuss this with someone before they get released, but I'm just kind of trying to think about in our Northeast Kingdom and some of those other areas, what we do with people who are already out there and these guns are in their house, these guns that are not federal firearms or state firearms.
Right. And muzzle loaders are not considered federal firearms either, but we've been pretty clear about that.
Right.
The condition is a standard condition, and what we're trying to do is just provide some definition to what that means specifically. And a violation of that presented by the Department of Corrections. In this case, the parole officer had explained to the individual that this was considered a firearm, and so it hadn't been clearly defined by us, other than the fact that we were concerned about the use of black powder firearms, of black powder guns. So,
But will there be any grandfathering, I guess I'm wondering, of people who are already out and may live in houses where, again, I'm really thinking of like Northeast Kingdom and some of those types of areas where it's hard for me to think of a house in the Northeast Kingdom that doesn't have a pellet gun.
yeah. Well,
Sorry, I'm not trying to be a jerk, but like, I don't
No.
want someone being homeless because their dad won't get rid of his pellet gun.
I'd go one step further and say firearm in any of those homes.
So that's
almost
true. Wayne.
yeah.
I almost wonder if we work on this for the next month until our next staff meeting and then come back with a solid, this is what we're going to do and these are the definitions. And that gives whoever wants to work on it, everybody, whatever the board chooses, time to really look into this and think about, do we expand the condition? Do we do a definition, or where do we go with this? Because I think I like the idea and I understand the idea. I just think there's so many components to it that if we come up with a decision today, then we have all of these other questions and all of these other things coming into play.
Yeah.
But that's just my opinion.
So I don't have a problem with us continuing to work on this. The concern I have is that different groups on hearing panels are making decisions on this based on inconsistent information. So I don't think we need to change the condition. I think we need to clearly define what it means. And that's, so I'm not looking to change the condition per se, but to define what we mean by, specifically possession and handling of a firearm and ammunition. So if we want to have additional discussion and change the language or whatever, that's fine. But I think we do need to define it and make it clear so we're consistent in our decision making.
I have no trouble with the definition. I mean, it's clear to me. It's very clear. And if we're going to make decisions based on our definition, I don't have a problem with it. To me, it's very clear about what we're saying.
Others, Pat?
It's clear to me.
I would like to take some time to maybe reword it a little bit. I think we could do the list. I think we could list it a little bit differently in more of a definition. But
Okay. Why don't we do this then? Why don't we take a look at this definition, and if anyone wants to edit, make some changes or whatever, put it together, and then we can finish our discussion next month at our in-person meeting and make a decision at that time.
And if we get any, and in the meantime, if we get any violations that involve a pellet gun or something that is not clearly a firearm, we can either look at postponing or we can look at the circumstances around it before we decide how we want to go forward.
Okay.
And I have a feeling that we have both prisoners. We have Emily here and Rob, our attorney here, that probably wouldn't object to that, I would think, depending on the circumstances.
Well, we have always made it clear that possession of a muzzleloader black powder
Yes.
weapon is a firearm by our definition. The only thing we're looking at now is whether to include the pellet type guns.
Well, I think also you're introducing replicas as well, and I think
Yeah.
that's another thing that's
Right.
that one along with the pellet guns, it's the replicas and so forth. So it's how far do we want to dig? Because to me, a replica could also not actually fire anything too, potentially, if somebody's just making a true replica.
Mm-hmm.
Good.
Well,
Go for it, Wayne.
no, I just, all due respect, what is the purpose of this, Dean? Of defining a pellet gun?
What's the purpose of it?
What is the purpose of it?
So
that-
Wayne, from wait a minute.
Sorry.
So Wayne, I know you asked Dean, but from my point of view, the purpose is, we have had 3 specific cases.
Yeah.
Within the last, I think, 6 months. 2 of them was voted that a pellet gun did not meet our definition, was not a Condition 5 violation, and then we just recently had one where it was determined that it did meet is a Condition 5 violation. So the question became, okay, so what is a Condition 5 violation then? And
that's the purpose, is to clearly define it and make us all consistent in our decision making on that one issue. So again, I have no problem with that. I think that's a good discussion, and take a look at the definition. If there are parts of it you'd like to see changed or eliminated, put it together and let's finish up on this next month with our in-person hearing. Okay. Anyone else on that? Great, thank you. Good discussion. Next up is our follow-up on our violation hearings, confrontation. MJ, did you want to just do an overview on the cases that we have there?
Sure. So I don't have a real specific overview. While we are here, I'm going to put you on the spot a little bit, Rob. So in the background is Robert Lees. Rob is our current attorney, he oversees the DOC litigation unit as well. So Rob put together these 4 cases. In response, Emily also submitted 3 additional cases that they may refer to. Kind of these are more of the flagship confrontation cases. Most of them are Vermont cases. One of them is a national case, Morrissey versus Brewer. So my suggestion today is this is a lot of legal reading. I just put the other 3 cases in there. I was hoping to not really dig into the cases today, but put them out there. I haven't had a lot of time to really dig into them myself either, and I was hoping in May we could dig into these further, but really wanted to just provide those flagship cases to all of you.
Great.
For right now. Would you agree, Rob?
Yes, I think that's right, MJ, and nice to meet everyone.
Good.
I'll be working with Emily on trying to answer any questions that come up. The cases I provided, there are 4 of them. I agree with MJ. I'm happy to discuss further at the next meeting. And as MJ said, Emily also provided a few in, I think, the probation context, as there's some overlap. But if once everyone has a chance to kind of digest the material, happy to kind of go through it with the board.
Thank you. That sounds good. Thank you. Nice to meet you as well, Robert. Any other questions or comments on the case review part? Great. Let's plan to review those next month in our in-person staff meeting.
And also, I understand that you all are not attorneys. We understand that, but we wanted to at least provide these to you. I will try to do a little bit of analysis myself on them as well before the next meeting.
Okay. We did want to talk briefly about our subpoena issues, and I know we've had a couple of cases where we have issued subpoenas for testimony that's required in confrontation and a violation hearing, and I think it's in part changed our role as far as how we participate in those hearings, since the Department of Corrections is no longer going to be doing that. And it does, particularly if the board is bringing in a witness that they have subpoenaed and feeling that person is necessary for the satisfaction of the confrontation of the evidence at that particular hearing, it becomes our responsibility. And I know most of you have probably been involved in hearings now where we've had to take the role of questioning of that witness, and certainly the Prisoners' Rights Office attorneys will question them as well. But for us to be able to get the information that we're trying to determine from that witness is important, where we haven't been doing that in the past. So I don't know if any of you have had thoughts on that or questions or comments regarding that. Particular case that I recall that we were involved in was a witness that we brought in, and I think we got the information that we needed from that witness in making our decision, and we're able to move forward. The problem is, do we want to have more witnesses, less witnesses, focusing on what's important to get enough information to make a decision on? It's typically a condition 1 violation. And that's a discussion that we would have as a board when the request for confrontation is made by the Prisoners' Rights Office. Emily, any thoughts from your end?
Let me just ask a clarification. When you say a request is made by the Prisoners' Rights Office, should we be sending you all an email on every case we have in advance and saying we're requesting confrontation? Or like, I'm just wondering what that, I just want to clarify so I can tell my people.
That's, in the past, we did sort of do that sort of thing, Emily. So we would know in which cases that your office is looking to confront the evidence, in particular bring in a witness. There are many that the evidence, in your view and our view, is not going to require a witness to come forward. If we know that, we're not going to waste time bringing that person in or persons in. But if there is a request for confrontation based on whatever from yourselves and the offender, then yeah, it would be nice to know that in advance. Then we could take a look at the case and try to get that person available for testimony at the hearing. We've also had a period of time where that wasn't done by your office, where it was just stated that it's your obligation to find the evidence you need to make a determination, and we're not going to tell you whether to confront or not. So if you do, that's very helpful.
So it's sticky. I think in some situations we feel comfortable disclosing, in other ones it involves disclosure of confidences. So obviously it's not like a clear-cut answer, sure. But I mean, I think I can talk to my people about how they want to handle that.
Okay.
Yeah, and so Emily, I think just to give you a little bit more history, is back a while, when DOC didn't have an attorney present, it was more of we would get those emails about we are not waiving confrontation. It wouldn't say what witnesses you wanted to confront, but it would just say more of we are not waiving confrontation in this case. And then the board would look at who to have subpoena served on. And then in other cases, then as the DOC attorneys came on, we stepped out of that role, and it was more of a discussion between Prisoners' Rights and DOC about that. And then we would hope that DOC would be asking for subpoenas for witnesses. And so now with DOC kind of stepping back out of that role, it's more of, I think, I would look at it more of that general rule of about whether or not you're waiving confrontation. You may not have to give your hand up with who you want to confront, if that makes a little bit more clarity.
No, I mean, I think it's going to be mostly condition one. I'm just playing in my head.
Yes.
I guess I can imagine a situation where someone gets removed from a treatment program, let's say, and they dispute the reasons. I can imagine that scenario too, but you're right. It's going to be almost all condition one. And I think we know pretty well in advance if we're going to question a condition one violation or not. So let me talk to my people about just that. I mean, the danger is that there might be a tendency for us to just in every case say we're not waiving confrontation.
Right.
You know, and I don't want that to become the opposite burden.
Yep.
So, but I'm just like playing that out in my head of how I would handle that. And so let me talk to my folks. I'm going to be meeting with everybody next week in person, but I'll also shoot them an email on how we do that. I don't think it's going to come up in the next week because I think I have the next set of paroles with this. But yeah, I don't think it's going to happen.
Yeah, and
Well,
I think with condition ones now, we are looking at the totality of the cases more,
Right.
and we've been postponing a lot of them. So I think it's a matter of just, and I think we've now started to work on a good working relationship with a lot of these cases and communication and so forth. So I think I'd be happy to talk with your folks too of how it would work, if how it could work better or not better and all of that as well. But I think we're starting to finally come down with a system as well.
And I think the only area, and I think we've talked about this before, where I see this being an issue is where the trial court is releasing someone on a new offense. Like they're saying either no bail or some bail that our client can make, $100, $200, whatever. And the parole board is the only one holding them. That's the situation where the condition one violations have to press forward sometimes. And so that's a pretty limited number right now. And so we can continue to work on that.
I think the big thing for us is, we're trying to only bring in subpoenaed witnesses when we need to, obviously. And it has changed our role from being just observing and listening and then making decisions based on both sides' presentations to being the ones that are going to ask the questions of the witnesses.
Right.
Which is totally not our role. And Emily, to waive confrontation, isn't that kind of an ethical violation for you? Other than having an agreement prior to the hearing that your client agrees with, how can you waive confrontation?
So Wayne, I can imagine a scenario, and I can imagine this because when I was doing trial work before I came into prisoners' rights, it came up a lot in bail hearings or probable cause hearings where, let's say it's like a relatively simple charge. Like, let's say it's a simple assault, but like a misdemeanor level or whatever, but we're worried that if the witness comes in, what they say would actually be worse than what the actual charge is. I can imagine a scenario where maybe it would be to my client's disadvantage to have the witness there, where we'd rather just rely on the affidavit or something like that. I can imagine those scenarios, but I will tell you that if I'm going to waive confrontation, my file is going to include extremely careful notes indicating my discussions with my client and that I did it. And that's why, like, it's a pretty limited, unless we have either an agreement or B, like, there are situations like if an officer pulls my client over and they're driving with a suspended license, it's often I don't need to confront that officer. It's really just a sentencing argument, or in your case, a continue or not argument. And so I guess it depends on the nature of the argument we're going to make. But yeah, it's very touchy for us. You're right. And I think whenever you waive a right, you need good notes.
And the other side of that coin is, I know you'll probably deny it, but in many times you go into collusion with their other attorney. So we have to bring a witness in. So you get 2 bites of the apple, or his actual defense counsel gets 2 bites of the apple to hear testimony, to have conflicting information. So this whole issue, I'm sorry, but I never felt this way until prisoners' rights walked away. But this is not our job to be. If we're going to be prosecutors, then let's be prosecutors. If we're going to sit in judgment, somebody has to bring the state's case. We can't do both.
So Wayne, when I was in New Hampshire, I think I've told you this, there were hearings like parole hearings where the parole officer essentially worked as a prosecutor and they would bring that in, and it was tricky. I will say that one thing since coming to Vermont, there's less value in me putting a witness on just to cross them in advance of trial because Vermont allows criminal depositions much more broadly. So I actually think that issue comes up a lot less in Vermont than in other states. But I hear all of your concerns, and I'm sure Dean does too, and everyone's like not loving this new role, but it's sticky.
No, and we certainly didn't ask for it, but we're going to make it work for us. We have no other opportunity. So, but at the same time, there are going to be cases where it's pretty clear and evident that something occurred and we don't need to bring in witnesses. And then there are other times where it's clear that we do. So we're just going to have to make that decision and bring them in. Okay. Anything else on that from anyone? Okay, last item up I got on that issue is another discussion around hearsay evidence and evaluating its credibility. And as everyone knows, we do consider hearsay evidence, and the important thing is to evaluate the credibility of the hearsay evidence. One of the things that we have talked a little bit about, and the last time I chatted with MJ about it was thinking it might be helpful for us to consider getting more information from the state of New Hampshire, who have, looks like kind of a developed protocol for dealing with hearsay evidence based on sort of the tier level of where it came from. So if, for example, a police officer was told by someone that something happened, that's firsthand hearsay evidence. But if that same person told the police officer that they had heard it from someone else, it's sort of third-hand information and not considered by that parole board. So I'm hoping that we can get some more information. And MJ and Sam, when you go to the conference next week, hopefully New Hampshire will be there. You might be able to garner some more details about that. But I like that idea, and I know Wayne, you and I had talked about that as well. Is a way for us to better define how we consider hearsay evidence.
I am also planning on taking a road trip, probably in June, maybe May, but most likely in June. I talked to the chair and the director of New Hampshire last week, I think it was. I had an informal meeting with them. I'm going to take a road trip over there and on one of their violation days and sit and watch their violations and talk with them more.
Great. That's wonderful. Thank you. Any other questions or comments on that issue? Okay. Well, let's move on to our legislative updates. And
actually, that is not our next topic. Our next topic is a reconsideration request for Storm Schwinner. I put it on Tuesday morning, and Storm sent in another letter that I stuck in the folder this morning.
Oh, I haven't read the letter yet.
I just put I put the other letter in there just before staff meeting, so none of you probably would have seen it.
Yeah, sorry, I got the old agenda.
Yep, that's okay. And I didn't add those two items to it this morning. My apologies.
And you said you put it in the folder?
Yes, there is a whole reconsideration folder. There's a folder in the staff meeting folder called reconsideration, and all the information is in there. There's a now one that's called Schwinner Storm additional letter, and that is the newest letter from him. It was in our mail pile.
Why don't we take a brief minute and just quickly go and review the information? Has everyone had a chance to look at that?
Yep.
So in considering whether or not to reconsider the hearing for Storm Chunye, I know Pat, Sam, and Wayne were on that hearing. Your thoughts and comments on that?
My decision would not be any different if I were to sit in on a reconsideration hearing for him. I think that he's a risk to the community. I think that this letter shows that he did 4 to 5 years of programming in a row and he still committed offenses after. I think that he's a risk to public safety in the community.
I went over the whole thing after I saw that we had the reconsideration, and I concur with Sam. I don't know that my decision would be any different. I find that he's a detriment to the community, regardless of what he says wasn't true in his letter keeps saying things weren't true, but I don't know that I would vote any differently. I went over my SDMF too, just to see what that entailed, and I wouldn't have changed anything on it.
One of the important things for us to consider in reconsidering any hearing is whether or not there's new and substantial information that wasn't provided to the board at the time of the hearing. And not convinced that there's anything significantly different than what was presented at the hearing itself.
I think the major things, if I'm reading it right, the major things that he's saying is different is the DR and whether or not the mother-in-law agreed to let him live there.
Right.
Right. And I think a little bit of the programming stuff, but the programming stuff to me kind of goes against him, because if he completed the program and then still got new charges, that kind of goes the other way for me. You know, it's like as against him, but that's just my thoughts.
Anyone else?
No, I don't think there's any new evidence and I looked at everything looked at the hearing. I didn't see anything new in it.
If there's nothing further to discuss, what is the pleasure of the board with regard to the reconsideration request?
I'll make a motion that we do not consider the reconsideration request.
Second.
Motion is made and seconded to not grant a reconsideration of the hearing for Storm Chunye. Those in favor signify by saying aye.
Aye.
Opposed? We are unanimous. Item number 7, an early discharge request for Eric Marcy.
He's the poster child for doing things right, in my estimation.
The interesting thing is his max date is 2037.
Yeah.
That was the only thing, but the guy has accomplished a lot.
He has, and I thought his parole officer, Max Maloney, presented a good case for us to consider this. Thoughts on that?
That max date is a concern.
Yeah.
That's a long way. It's not like it's a year or 6 months.
Right.
It's
right.
That's a precedent if you want to. That's a precedent that you want to be setting. The only one I remember was one that was way out there, but he was in a wheelchair and couldn't walk.
Mm-hmm. Yeah.
Other than that, I don't think we've ever done one this far out.
I was going to say, why is this brought so far out? I think, I mean, I haven't been on the parole board too long, but I've never seen one 6 months, like other than 6 months.
The ones that are brought before us at staff meetings are the ones that are over 6 months. So we have had a number of those over the years. But the ones that are 6 months or less, we do not have a decision to make at a staff meeting. So today's decision isn't to grant it, it's whether to move forward with the hearing.
Oh, so it's not actually to grant it, it's just to move
No.
forward.
Yeah. Any other thoughts? Questions?
I mean, my thought is, I think it's too far out, and I can't. I mean, that would be a concern for me. Wait to bring it forward for a hearing.
I guess I don't see any harm in at least seeing them. I mean, that's just my opinion. I get that the max date is far out, but I don't see the harm in at least getting in front of us so we can interview him and ask him those questions. But
Yep. Well, and it is part of our responsibility by statute to consider those requests.
In my opinion, would be as if the board was to rule it was too far out, then we would need to look at our policy because our policy does not have any restrictions in it.
Yep, I understand all that.
Yeah.
But
And you could make that decision at the hearing as well, that from your perspective or the board's perspective at that time, that we need to have additional time before we would grant this or not. So from my perspective, I think the information that was presented to us makes a good case for consideration of it.
I do too.
The reason we do this in this format is so that all the board members get to weigh in on it, as only 3 are going to make the ultimate decision. So everyone gets to weigh in on whether or not we want to let this case move forward with a hearing or not. And so,
I mean, I agree with Sam. I don't think there's any harm in letting him come before us and make his case. But I also agree with Tom. It is a long ways out.
it is. Yeah. And it's cause for us to look carefully at this. We make Wayne, are you still there?
Yeah, no, I agree on both counts. It's way too far out. But I guess if he wants his day in the sun, he can get it. Then I look at the charges too, and I'm like, yeah, he's a motor vehicle guy. If he was a rapist, it might be different. But
Yeah,
so
but I mean,
there's a whole bunch of components to throw in here, but to try to treat everybody the same, you're right back to it.
I mean, it is a motor vehicle infractions, most of them, but there are a lot of, there's DUI 4s on here. Like that's
serious offenses.
That's very serious and it's only been a few years, substance relapse can happen at any time, so.
But I guess like right now, I don't feel like we need to get into that nitty gritty
Right.
of all of that. Like we're just making a decision on if we see him or not saying he's gonna be the golden person, but I mean, let's just make the decision if we're gonna see him or not.
And our policy is very gray and very vague. And I think the board left it that way on purpose, is to do it that way. So I want to just be clear that some of these conversations you're having are more policy, some of the policy questions. And if we want to debate that at a future staff meeting, we can put that on an agenda.
good point.
Any other discussion on the merits of this case and whether we should schedule a hearing?
I'll make a motion. We schedule a hearing.
Okay.
I'll second.
Motion has been made and seconded to schedule an early discharge hearing for Eric Marcy. All those in favor signify by saying aye.
Aye.
Aye. Those opposed? Okay, we are 7 in favor and nobody opposed. Thank you. Now we can do the legislative updates. MJ?
All right, H559, an act relating to the parole board has been moving. I'm hoping it gets heard for its second reading today in the Senate. It was supposed to be heard yesterday and they didn't get to it. So Senate institutions heard the bill. It got held up a little bit because there was an amendment in the bill proposed by the Center for Crime Victims. I never know the complete title. I always get it wrong. to clean up the victim statutes regarding notification for parole hearings. There was 2 statutes, one in Chapter 13 and one in Chapter 20 in our parole statutes in 28 that said 2 different things regarding how victims of listed crime should be notified. That was brought up. The committee took it on. What we did was in the Chapter 13, the crime victims statute, that language was amended to put a citation back to the language in our parole statutes, and we amended that language in our parole statutes to encompass both languages. So basically, it's the difference between these 2 statutes were that victims could, in one statute, victims could opt in for notifications, and one statute said they could opt out of notifications. So the consensus of the victim groups, DOC and ourselves, was it's better to have the opt out so everybody gets notified, and then if they don't want to be notified, they tell us. And so now it's consistent that they can opt out. And they can opt out verbally or in writing. Before it was just in writing. And DOC would just notify everyone if they are opting out of that. That was the major change. There's also Senate Appropriations, along with the Joint Fiscal Office, did change some language around the carry forward of the appropriation, the $25,000. That's not in the bill that's in the folder for you. That happened the other day. It's just to clean up the language of how it should be around the $25,000 carry forward. So if all goes well, which I would think it would because it's gone favorable out of all committees unanimously, it'll go out of the Senate, and then the House is going to have to look at it again because it did have a change since it was been at the House. But the House is aware because that change was first brought up there, and they suggested to go talk to the Senate and put it in this bill.
Oh.
So with that, the bill would go effective July 1, and at that time we could start seeking to go out to bid on a contract attorney, which would then, their overall goal per the bill would be to look at training specifically around violations for the board. That would be their first Any questions?
No,
Good
but
work,
I want to
MJ.
say I really appreciate you
Yeah.
posting a link right to it so that we can
Yeah.
kind
Yeah.
of go and look at the changes and what's been, the drafts of it. So I really appreciate that. Thank you for
Yeah.
doing that.
Yeah. I've met a lot of senators and representatives this session, and even though in the Senate I didn't testify a whole lot, I just sat on the sidelines. It was a good experience to be able to meet those individuals, and I also gave the Senate institutions a 101 as well, a little bit of all the work that you do, and it's really opening eyes to how much work you all do.
That's great.
Democracy is an ugly business.
Wallet.
Yeah.
Do they seem to be pretty supportive, MJ?
They're
the
very
most part.
supportive of you all.
Good.
And the work
Good.
that you're doing. They also realize that that you are all undervalued as well. Around they can't believe the amount of work you do for such little pay. They call you all basically volunteers. And so that, I think, could be something to come up in future sessions. I think this is I got our foot into the door of looking at the board, and then what the future holds, I'm not sure, but I'm starting to get us more a seat at the table and more noticed, which is where we haven't been as much.
Okay, good. Must be a whole different group of people in legislature, because when I was there for a whole legislative session fighting for stricter DUI laws, they weren't real receptive. So it's nice to know that, you know, they're thinking about things now.
Yeah, I think it depends, and it also depends on the issues and
Yeah.
so forth. And
No, I know
I
the
think there's a
Rutland,
lot.
yeah,
Good to
the
hear.
Rutland senators are very supportive of you. I know that, so.
Yeah, it's been a lot of work on MJ's
Yeah.
part. to get
Yeah,
everything-
Yeah.
I've heard, they have contacted me and they've been
Yeah.
very supportive, so that's to your credit, MJ, that the unsolicited comments, so, like Senator
Yeah.
Collins especially, so.
That's
Well,
kind.
the one thing I have to say is I also have to put some credit out to Todd Delos at the Attorney General's office, who we had brought this issue up with him when he was Deputy Secretary, and he was able to get traction over in the between him and Lori were able to get traction on most of this with the Attorney General. And
Great.
so he helped get this into House institutions.
Okay, thank you. Do we want to put our executive session on next here?
We can.
Sure. All right, I'll make the motion. We go into executive session to discuss what Chairman Dean had said regarding civil.
Second.
So the motion has been made and seconded for the board to enter executive session to discuss a matter that's potentially involving civil litigation, which we may be involved as a party. All those in favor signify by saying aye.
Aye.
It is unanimous.
I would like to also bring our attorney with us, if that is
Certainly.
okay.
Yep, and that would include Attorney Robert Lenz.
Please,
Please,
yes.
Please, I'm sorry. All those in favor then of that motion signify by saying aye.
Aye.
Okay, we're unanimous.
And MJ, this is Emily. I'm going to exit while they go over there. Thank you all.
All right. Thanks, Emily. We are back.
Great, thank you. Roundtable, let's start off with Angela. Anything for us, Angela, today?
No, I don't have anything. Thank you. Sorry for
Sam?
being like, oh, I got,
Sorry. Yes, you do.
I thought of something. So now that I'm on the parole board, I got asked for donations for Dismas House. They were doing a fundraiser for my business. But they are willing to give a tour at any of the Dismas House locations if anybody's ever interested in going and seeing it. Do you guys know?
Thank you. Yeah, I think that's a great
That's
idea. Yeah.
Yeah.
It's been a few years since we've done any field trips, but they're always beneficial when we do.
Yes.
Yeah.
I also have the transitional housing folks from DOC coming in May. So maybe that's something we could talk with them about when we meet with them in May to maybe schedule a summer. Because I think it would be beneficial to have DOC with us as well. And maybe we could set up some other agencies in the same town.
And I can, if you want me to, I can also talk to Paradise Recovery and V4 down here in Bennington.
Great.
Anybody wants a road trip down here?
Yeah. I think
That's a 2-day trip.
Yeah.
Yeah, I definitely want to coordinate with DOC as well, so we can make sure they're aware as well. Seems that they're the ones holding the contracts.
Yep. Thank you. Good idea. Sam?
MJ and I are headed to APAI next week, so I'm excited about that. There looks like there's some really good sessions, so I'm excited about that. Chairing's been going well, so thanks to Dean for taking the strong violations, and I take the easy ones. But we'll get
You're
there.
doing fine. Yeah.
We'll get there.
Yes, we will.
That's
Thank
all
you.
I have.
Thanks. Pat?
Yeah, I guess at some point, I'd like to look at condition number 16, work and reside only where approved, around the whole thing about getting terminated from a treatment. And that, at this point, we can't violate somebody because it said that they weren't going to another residents because they got arrested or they got taken in by DOC before they had a chance to even leave whatever treatment program they were on. And I'd like to talk about the wording of that at some point.
Okay. And how it reflects condition 16 specifically?
Yes. Yeah. Because right now, if they get terminated from a program, huh?
There's really two different issues. There's condition 7, which is the program violation.
Right.
And condition 16 is living in an approved resident.
Yeah, they're really melded together when they get terminated from a treatment facility, and it's they say they didn't have a chance to go anyplace else, so they didn't violate that condition.
Right.
Well, do
you mean if they get taken straight, if they get terminated from a program and then they get automatically picked up
incarcerated?
So we have to look at
warrant put on them?
Yeah.
I'd like to step back, and I think we have two issues. One is pure housing and one is a program. And I think you have to look at them separately. So the question becomes, did they violate program rules? Most likely because they got kicked out of the house. Their housing, they lost their housing because they got kicked out of the program, but they didn't have another opportunity to find housing because they had nothing, so they went right back to jail. So I think it's looking at it in two lenses. It's not all the same lens.
Right. Yeah. But they're sort of melded together.
They are, but
a lot of times
we can put that on the agenda.
We're gonna put it on
a couple of cases that we've actually made decisions on that, so it'd be good to review them and
I will find them.
into open discussion.
Okay. Thank you.
Thanks, Pat. Yeah.
That's all I had.
Okay, Katie?
So I had another case like this again come up, and I feel like lately more and more we are getting, I remember what day it was. I think it was just recently, maybe even last week, where it was a full day of considerations and almost every single one was not recommended. And I feel like that's happening so much, we actually overturned one of their decisions. And I always kind of struggle with that a little bit because I don't know what that's going to mean in terms of straining the relationship and.
So Katie, just before we go too far into this, one of the important things is that the day you're probably referring to is the day where those folks are being incarcerated for the most egregious offenses. And it typically falls on that one day every month. So you're going to get
day.
Either
Is
northern
that what the day it was? It was like OOS or something.
So those cases they're not totally representative of all the other days. They're specific to that particular location.
No, I mean, I just remember we had a ton that day. And
so Katie, can I just give you a little overview of that day, Katie? So that one day a month, the last Wednesday of the month is the Northern Out-of-State Day. And Northern has the most sentenced population in the state. So that's why they have their own hearing day of just parole hearings. Sometimes they overflow back onto that Tuesday, which is also their violation day because we have to split them up in 2 days. And like Dean said, these are the cases that are Northern has the cases who are programming. They have the cases who are the more egregious cases. And so you're going to come up against them. And also with the new public safety initiative, it's not just Northern, but throughout you're seeing a lot more not recommended.
Yeah.
And so
that's happening a lot.
And what I keep telling you all is you're grounded in your structured decision-making framework. That's your framework to help you make your decisions. Use that while you're making your decisions. Don't look at it. And I think I even said it to you. I don't know which day I said it in deliberative is rely on your training. Don't rely on DOC.
Right.
Yeah, whether they're recommended or not is not material to our decision. It's the overall picture of everything.
But my question with all of it, and this is just mainly out of curiosity too, because I know when we did it last week, it wasn't the first one that we've overturned.
Yeah. They're not being overturned. Don't look
Yeah,
at it
yeah,
like
Or
that.
I mean, like
overturned.
not. I don't mean overturned. I mean like not
Yeah.
Going
with
against the recommendation.
Yeah. Are you hearing anything, MJ, from DOC about those ones that we have? Like, are you getting any pushback? Are you
I mean,
getting any
I do.
cases filed by it or anything like that?
So any risk containment and RSN cases, I send a courtesy notification over to DOC and let them know. Usually they don't talk about us. I know at one point the commissioner was very upset over a lot of these. He has not came over to talk to you all. I think it's a matter of, and it's just, I've had conversations with the commissioner. I've had conversations with other folks. It is frustrating. It's frustrating for them because of the work they are doing to make, and when you guys kind of go against the work that they are doing. But you're your own independent body. I don't get a lot of, we don't discuss a lot of cases. If they were very adamant that they should not be paroled, they can submit a rescission hearing and submit further information that may not have been provided by the caseworker. Some of them that do get overturned, I question myself. I will put it right out of there on the record. I question sometimes the overturns that you're doing, but I'm not a board member. So I would just say, follow your training, follow your thoughts and your decision making.
Yeah, no, and I do. And you know, if like there was one I felt strongly on last week and we did it. I just didn't know if there's been anything that's kind of come down the pike on the few that we have done at all. And I don't even know why I'm worried about it, but
No,
to be
you shouldn't
honest,
be.
but it's just something that crosses my mind every time. But
It's really important for us to use our training and our SDMF process, and whether they're recommended or not is really immaterial to the decision. It's more about the information that's contained in there and the interview process and what comes out of that, the planning, so forth. And I think as a rule, the board does a good job of making a decision. Yeah.
Yeah, sometimes it gets really, really frustrating because nothing's been, the offender may have a great plan, but nothing, DOC hasn't verified anything. So even if we like it, because it hasn't been verified, sometimes that holds us up too.
And so that's part of the process. Yeah.
And I think that's the other plan. The other thing too is also weighing that great plan. Because some of those plans you see, they may sound great because they're speaking a great speak because they know how to speak that. So that's just a word of caution of also looking. It goes back to some of their history as well and their risk to the community and what are their charges, and just kind of weighing all of that information in your decision and not just looking at their plan.
Yeah. I don't know if anyone else has been kind of tossing that over in their head, but.
Nope.
It's just me.
I know. I'm just kidding. Thank you, Katie. Wayne?
I was just didn't realize I was muted as usual. No, just for Katie, I've seen an evolutionary change, but it used to be a lot of times the parole officers would come in and do double speak. They would be recommending them, but they'd have to take the corporate policy and say, pursuant to, I cannot recommend them. But they were all about, this guy needs to go. But I haven't seen that in a while, so somebody did something somewhere.
You're right, Wayne. I haven't either. I did see that a few times, but I have not seen that lately.
Yeah. I have 1 to 3 items, but the more I got thinking about it, maybe should have gone into the deliberative or executive session might be more appropriate. Or if we can go there and you decide now, we could go back to the public side. There were a couple of things that happened last week, MJ. I think you'll know what I'm thinking about. That probably be better in executive session.
Well, we have to have it needs to fall under confidential litigation,
No, it has
personnel.
nothing to, it's policy issue.
Yeah, I think policy issues need to be done in public session unless it's confidential.
Let's talk about it after the meeting and then put it on the agenda for next month, Wayne.
Okay.
Anything else?
Yeah. Food for thought for y'all. Is this a firearm? Is this a firearm?
To me, it is.
Looks like one.
Sure does, doesn't it? It's
Did you make it out of your
It's a
3D
blank-
printer?
it's a blank gun that shoots a 309 shotgun primer for training my dogs. So that's what I'm saying. Are we going to go down that? How far down this road are we going to go?
We're going to go to the
Just
end.
for your thoughts for next month's discussion.
We're going down the dead end road, I think there.
Yeah. Thank you, Wayne. Anything else?
That'll do it.
All right, Tom.
Don't keep asking him anything else.
I know.
The only thing I have is my disdain for the RSN, how they're using it, and when I see it on the and that's, I know what Katie Stockey, I was on that board. I don't think a lot of the questions people are thrilled about how it's being used, and I think that it's a unfortunate thing that's happening, and the RSN especially bothers me, and especially when they had a plan in place and a week later they say, "Oh, now you're RSN." Make them RSN before. I mean, don't do all the work and then say, "Oh, now you're RSN."
Right.
I think
I would just ask that nobody uses that in their decision making. That you use your tools in your decision making, not your personal opinions on DOC policy.
No, well, what I'm talking about is when they throw.
No, I know what you're talking about. It's just the way you phrased it.
I'm afraid
When you
I don't
said
use
disdain.
I don't use RSN in my decision. I don't like the idea that a lot of the work that the PO and the caseworker have done, and then all of a sudden for the release and everything was on target, and then all of a sudden to have a policy come in and say, well, no longer would they be recommended. Not that that makes a difference to me. I just think it's I don't think it's used appropriately in how we in my humble opinion, of course. That's it.
Thank you. I think just as an aside, it's really important to review the case staffing reports. And I know most of you are pretty good about this. If it's not there and it's referenced in the report, make sure you send a quick note to MJ or Kobe to see about getting that included.
You've been very good about staffing.
I am the only one that pulls those reports, just to let you know.
Okay.
I don't think I've had I don't think I've not had a staffing the last several weeks that wasn't in the packet.
Good. Yeah.
We had a case staffing last week or 2 weeks ago. Case staffing was parole eligible, but we're revisiting for RSN designation. They're saying parole them, but within a couple of weeks, we're going to warehouse them. It just made no sense. No sense.
We have had those, Wayne, in cases where somebody, and maybe it's the same case, where somebody had a great plan, was looking at residents, then the receiving field site asked for the person to be looked at as RSN before they would even consider that residence.
Yep.
So the field offices are going against each other.
Oh, interesting. Yeah, I hadn't heard that.
Yep.
Yeah. I've seen that.
Yeah. Wow. Okay. So the other thing was quickly, I think everybody got the note from MJ that the hearings for next Tuesday are canceled. Did you all get that?
I already have it on my calendar. I'm gonna do.
Okay.
Are we doing something in the month to make that up, or are they going on overflow or something?
So as of right now, they are going into June. They were all violation hearings. They were all, Jill had a conflict that day. And nobody's asked for any of the cases to be put on any sooner than June, and most of them were already postponed cases or so forth. So
Good.
I didn't have a problem with that.
No, that's great.
So I don't know what, at this point, like always with overflow, we have to wait until we get there. I've got to look at Rutland Marble Valley Day right now because there's a lot of PVs on that. I've been trying really hard since we've now been working with the condition ones a little bit more. I've been trying really hard to look at the violations that involve all the violations before schedules go out to try to figure out if they should be postponed or not. I'm doing a lot of preemptive postponing now instead of waiting if it's a case that I can't tell. So basically, some of the factors I'm using are somebody's held without bail by the court. Dean and I have had these conversations of what's the rush? Why do we need to hurry this case along on the violation side if they're held without bail? PRO seems to be in agreement with that. DOC has now come around with that.
Yeah, makes sense.
And same thing with high bails. Cases who have been previously postponed, if we have reasons, I may check in with the attorney and DOC and just say, hey, are we looking at another postponement next month? Really trying to follow the criminal cases along as well.
That's great too. That's very helpful.
That's good. I'm surprised. I think DOC just probably wants the revocation on record, probably. Yeah. Good.
Good. MJ, did you get any more information on the Colorado SDMF
Yes.
conference? Yeah.
You didn't ask me for a roundtable.
Yeah.
So
I am now.
June 2nd through 4th, Angela, Katie, Carla, and I will be going out to Colorado to NIC to the SDMF Community of Practice. Our travel day is going to be June 1st. They sent out the initial information. I meant to email you, Katie and Angela, to make sure you got that email the other day from George. I think it should have been in your state email. I can forward it. And you should have some emails on how to set up your NIC expense accounts and so forth. But we will be booking travel
Sorry.
We'll be booking travel pretty soon once we get those instructions and so forth. But that's the first week of June. So
good.
I don't think that'll affect hearings with only 2 board members going. But if it does, just let me know around availability and we can shift hearings.
Great. Anything else, MJ?
I don't think so. I think I'm just scattered and crazy and trying to keep afloat.
Don't forget the pack.
Yeah.
Oh, don't worry. I'll throw something together. I'm starting a pile, Tom. I'm starting a pile. That's how it usually goes. I got to get the boys ready for me to leave too. That's always a big one.
Of course.
Great. Okay, I think we're all set with the schedule, the updates.
There was one other May change just for all of you. I haven't changed it on the website yet. Overflow and staff meeting have been swapped in May. So staff meeting is on Tuesday, overflow is on Thursday.
Staff meeting's on Tuesday. Okay.
Yep, and it'll be in person here at 5 Pilgrim Park. I will send you all some instructions.
And a map.
It's pretty easy.
Is it? Okay.
If it's near the cafeteria or if it's near the lunchette, I can find it.
Yeah, you just go over the railroad tracks and we're straight ahead, basically.
That's right. I figured you were.
Or to the left a little.
You're not in the old coffee building, are you?
We're in I think the old headquarters building.
Oh, really?
Okay.
Yeah.
All right.
Okay.
Okay.
And there's a lobby, so I'll have you all wait in the lobby and we'll bring you all up at once because it'll just be easier.
Okay. Super. All right, everybody. Thank you for everything. Make sure you get your expense accounts in. Check your state emails. Just a reminder.
Yes, expenses. I try to get them in as quick as I can. With me being in New Orleans next week, it might be slightly delayed. So if you haven't got them to Dean, because today's the end of the month, holy moly.
It
Ian
is.
usually gives them to me bright and early on the 1st, so if you haven't gotten them to him.
You can't do it to the last thing. Wait till the
You had
last
to wait
meeting to
until
do it.
today.
Right.
It may be next week for me too, because I'm traveling over the weekend.
So that'll work. So if you get your expenses a little later in May this month, it's because of the way the month
man.
fell.
That's fine.
All right, everybody. Thank you.
All right.
Yep.
Thank
Do you
you.
need a motion to adjourn?
Motion to adjourn.
I have one. And second, all in favor?
Aye.
Any
Aye.
opposed? Good. Thanks, everybody.
Okay.
Bye, everybody.